Imagine a woman named Margaret. She's 63 years old. She walks every morning, watches what she eats, takes her medications exactly as prescribed, and never misses a checkup. By every measure, she is doing everything right. But for the past 2 years, Margaret has felt off. There's a fog that settles in by mid-afternoon, a stiffness in her joints that wasn't there at 55, a tiredness that sleep doesn't seem to fix, and occasionally, just occasionally, a strange tingling in her fingertips that she keeps meaning to mention to her doctor. At her last appointment, her labs came back, and her doctor smiled and said those 4 words every patient wants to hear. Everything looks perfectly normal. So why does Margaret still feel this way? Here's what most people in Margaret's position never find out. There is a biological trap that can quietly form inside the body, one that standard blood work is not designed to detect. It doesn't announce itself. It doesn't appear on your typical panel. And it can develop in people who are, by all appearances, taking excellent care of themselves. In fact, it may be because of certain medications millions of people over 50 take every single day, that this trap gets set in the first place. Today, we're going to talk about what that trap is, how it forms, and most importantly, exactly what you can do about it. I want you to hold on to 2 questions as we go. First, why would a normal blood test miss something this serious? And second, how does a vitamin deficiency cause strokes in people with perfect cholesterol? By the end of this, you'll have answers to both. Let's start with something that surprised even many of my colleagues when they first encountered it in the research. Most of us grew up thinking that vitamins work simply. You eat food containing a vitamin, you digest it, it enters your bloodstream, done. But vitamin B12 doesn't work that way, not even close. B12 is what I call an escorted nutrient. It cannot enter your body alone. It needs a very specific, carefully coordinated process, and that process has 2 critical steps, either of which can be silently broken without your knowledge. Here's the first step. When you eat food, whether it's a piece of salmon, an egg, or a slice of beef, the B12 inside that food is chemically locked onto proteins. Think of those proteins like a vault. The B12 is the treasure inside. And stomach acid? Stomach acid is the locksmith. It's the only thing capable of picking that lock and releasing the B12 so your body can use it. Now, here's where the first part of the trap is set. A class of medications called Proton Pump Inhibitors, you may know them as Omeprazole, Nexium, or Pantoprazole, work by dramatically reducing the amount of acid your stomach produces. For people with acid reflux or gastric ulcers, they provide real, meaningful relief. But here's what the prescription label doesn't tell you. When you suppress that acid, you're not just calming your stomach. You are putting the locksmith to sleep. The vault stays shut. The B12 stays locked inside the food, and it passes through your body without ever being absorbed. What's fascinating is this can happen even if you're eating a perfectly nutritious B12-rich diet every single day. So the locksmith is asleep. But let's say, for a moment, that some B12 does get released. Maybe you're not on a full dose of a PPI. Maybe your body is still producing a small amount of acid. A little B12 makes it out of the vault. Is it safe now? Can it proceed into your bloodstream? Not necessarily, because there's a second checkpoint, and this is where the story gets even more surprising. Once B12 is freed from food, it needs a transport molecule to carry it across the gut lining and into circulation. Scientists call this molecule intrinsic factor. I like to call it the B12 taxi. It's produced by special cells in your stomach lining, and its entire job is to pick up B12 and ferry it safely to where it needs to go. Now, here's the second part of the trap, and this one involves a medication that hundreds of millions of people worldwide take for type 2 diabetes, metformin. Metformin is genuinely effective. It helps regulate blood sugar, and for many people, it's a cornerstone of their diabetes management. But research has shown that metformin alters the electrical charge along the gut lining, and that change makes it effectively impossible for the B12 taxi to pull over and pick up its passenger. The taxi is circling, the B12 is standing on the curb, but the pickup never happens. This is the double roadblock. PPIs prevent B12 from being released. Metformin prevents it from being absorbed. And if you happen to be taking both, which many people over 50 are, the trap is set from both directions simultaneously. Here's the critical insight. You can have a perfectly healthy diet, take both of these medications as directed, and still be running critically low on B12. Now, you might be thinking, surely this would show up on a blood test. Surely, if something this significant were happening in your body, your doctor would catch it. And this is where I have to tell you something that I wish were not true. The standard blood test for B12, the one ordered at virtually every routine physical, is called the serum B12 test. And while it sounds reassuring, it has a fundamental limitation that most patients are never told about. Here's the analogy I use with my own patients. Imagine you want to know if a city's economy is healthy. So someone hands you a report that shows how much money is sitting in the bank vaults. Lots of money in the vaults? Great news, right? Except that test tells you nothing about whether money is actually being spent in the shops, nothing about whether businesses are open, whether workers are being paid, whether the economy is actually functioning. That's exactly what the serum B12 test does. It measures B12 floating in your bloodstream, in the vault. But it doesn't measure whether that B12 is actually getting inside your cells, where it does its work. And here's what makes it even more deceptive. There are inactive forms of B12 in the blood, fragments and analogs that have no biological function, that the standard test counts alongside the real thing. They inflate the number. They make your result look healthier than it actually is. This is why Margaret's labs came back normal. This is why millions of people walk out of their doctor's office reassured, while their cells continue to go without. But there is a test that can catch this, and we're going to talk about it next. The test is called methylmalonic acid, MMA for short, and I want you to remember that name because it may be one of the most important things you take away from today. Here's how it works. Inside every cell in your body, B12 plays a very specific role in a chemical process. When B12 is present and functioning properly, a compound called methylmalonic acid gets converted and cleared away. It doesn't accumulate. Everything moves smoothly. But when B12 is actually unavailable at the cellular level, even if your serum blood test looks fine, that conversion can't happen. Methylmalonic acid starts to build up. It piles up in the bloodstream like uncollected waste. So when a doctor measures your MMA levels and finds them elevated, that is cellular-level evidence that B12 is not doing its job, regardless of what your standard B12 test says. Think of it this way. The serum B12 test shows you the inventory in the warehouse. The MMA test shows you what's actually happening on the factory floor. This is why I call MMA the forensic test. It doesn't just describe what's present in the blood, it reveals what's happening inside the machinery of your cells. And here is the counterintuitive truth that I want you to sit with for a moment. It is entirely possible, and not uncommon, to have a normal B12 reading and an elevated MMA at the same time. When that happens, the B12 ghost is confirmed. Your cells are starving, even though your chart says otherwise. Now we've answered the first question I asked you to hold. But the second one, how does this cause strokes in people with perfect cholesterol? That answer is coming, and it involves a substance with a name that's hard to say, but an effect that's impossible to ignore. When B12 is absent from your cells, your body doesn't just slow down quietly. A specific biochemical process breaks down, and as a byproduct, a toxic compound begins to accumulate in the blood. That compound is called homocysteine. Under normal conditions, B12 helps convert homocysteine into harmless substances the body can use. It's a routine maintenance process, happening constantly, keeping levels low. But when B12 is missing, that conversion stalls. Homocysteine builds up, and elevated homocysteine is not a passive finding. It is an active threat to your cardiovascular system. Here's the mechanism, and I want you to picture this clearly. Your arteries are lined with a delicate layer of cells called the endothelium. When this lining is healthy, your arteries behave like flexible rubber hoses. They expand and contract with each heartbeat. They respond to your body's needs. They stay smooth and open. Elevated homocysteine acts like fine-grained sandpaper on that lining. Slowly, persistently, it roughens the surface. It creates micro tears and inflammation, and over time, those flexible rubber hoses begin to stiffen and become more like brittle plastic pipes, rigid, narrowed, and far more vulnerable to the kind of sudden blockage that causes a stroke or a heart attack. And here's the answer to the second question I asked at the beginning. This damage happens independently of cholesterol, independently of blood pressure. A person can have textbook perfect numbers in both categories and still have homocysteine quietly abrading their arterial walls for years. This is why strokes and cardiovascular events sometimes seem to come out of nowhere. They don't come out of nowhere. They come from the inside, from a process that was invisible on every standard test. This is the part of the conversation that I find most important and most overlooked. Arterial damage doesn't happen in a moment. It doesn't appear overnight. It accumulates across years, sometimes across a decade or more, quietly, incrementally, beneath the threshold of any symptom you'd consciously notice. The tingling in Margaret's fingers? That had likely been building for 2, perhaps 3 years before it reached the level where she noticed it. The fog, the stiffness, the fatigue, these weren't new problems. They were the visible edge of a much longer, much quieter process. This is actually how most age-related cardiovascular events unfold. The moment that feels sudden, the event that arrives without warning, is almost never the beginning of the story. It is simply the first chapter that becomes visible. What's fascinating and genuinely hopeful is that the research tells us this process is largely reversible if addressed early enough. The endothelium has a remarkable capacity to repair itself when the source of the damage is removed. Arteries that have been roughened by homocysteine can become smoother. Cells that have been malnourished can begin to recover function. The timeline works in both directions. The reason I'm sharing this is not to frighten you, quite the opposite. I'm sharing it because understanding the timeline gives you power over it. When you know that damage accumulates silently, you also know that repair can begin silently, long before any dramatic symptom appears. The question is simply, are you giving your body what it needs to begin that repair? And the answer starts with understanding exactly what form of B12 your body can actually use. If you've ever stood in the vitamin aisle at a pharmacy and picked up a B12 supplement, there's a very good chance the label said one thing: cyanocobalamin. It's the most common form of B12 in the world. It's inexpensive to manufacture, stable on shelves, and it appears in the majority of standard multivitamins. And if you're under 40 with a healthy liver and no absorption issues, it can work reasonably well. But here's the problem, and this is something the supplement industry doesn't advertise prominently. Cyanocobalamin is not a form of B12 your body can use directly. It is a precursor, a chemical puzzle that your liver must first disassemble before any B12 activity can occur. Specifically, your liver has to remove a small cyanide-containing molecule from the compound and then reconstruct the active form from scratch. In a young, robust liver, this conversion happens efficiently, but as we age, liver function naturally becomes less vigorous. The conversion slows, the efficiency drops, and you may be swallowing a supplement every morning that your body is increasingly unable to process into anything useful. Now, contrast that with methylcobalamin. Methylcobalamin is B12 in its biologically active form. There is no conversion required, no puzzle to solve, no demand placed on the liver. The moment it enters your system, it is ready to work. Think of cyanocobalamin as receiving a piece of furniture in a flat pack box, assembly required. Methylcobalamin is that same piece of furniture, already built, already functional, ready to place exactly where it's needed. When you are over 50, when your liver's conversion capacity has naturally declined, the form you choose matters enormously. But even the right form needs to reach your cells, and that requires one more critical consideration. Here's something that surprises many people when they first hear it. Even if you choose the correct form of B12, even if you purchase methylcobalamin and take it faithfully every morning, if you're swallowing it as a standard tablet, you may still be routing it directly through the same broken pathway that caused the problem in the first place. Remember the double roadblock? PPIs suppressing stomach acid, metformin blocking gut absorption. A swallowed tablet, no matter how well formulated, still has to travel through that same compromised territory. This is where the delivery method becomes as important as the molecule itself. Sublingual administration, meaning dissolving a small tablet or applying a few drops under the tongue, uses an entirely different route. The tissue beneath the tongue is richly supplied with capillaries, small blood vessels that sit just beneath the surface. When B12 dissolves there, it passes directly through that tissue and into the bloodstream within minutes. No stomach acid required, no intrinsic factor required, no gut lining to navigate. The locksmith, the taxi, the roadblock, all of them bypassed completely. For someone managing acid reflux with a PPI or controlling blood sugar with metformin, this single change in delivery method can make the difference between a supplement that works and one that cycles through the body without meaningful absorption. It is a small adjustment. It costs no more than a standard supplement, and it works with your biology rather than against it. But here's the thing. Even knowing all of this, you still need one more tool. Because the most important conversation about your B12 status isn't the one you have with a supplement label, it's the one you have with your doctor. And most people don't know how to have that conversation effectively. Margaret went back to her doctor. But this time, she didn't go back saying she felt tired. She didn't go back hoping someone would notice something new in her chart. She went back prepared, with specific language, specific requests, and a clear understanding of what she needed to know. She said, "I'd like to request an MMA panel and a homocysteine level test, please. I want to check for an absorption gap." Her doctor paused, then nodded. That's a very informed request. The results came back 2 weeks later. Her serum B12? Normal, just as before. Her MMA? Elevated. Her homocysteine? Elevated. The B12 ghost confirmed. With that information, her care team was able to adjust her supplementation strategy, switch her to sublingual methylcobalamin, and begin actively monitoring her homocysteine levels over time. I tell you Margaret's story because the most powerful shift she made wasn't a medical one. It was a cognitive one. She stopped being a passive recipient of her own healthcare and became an active, informed participant. The terms to remember are these: MMA panel, homocysteine levels, absorption gap. These are not obscure or experimental requests. They are legitimate, evidence-supported tests that any physician can order. Using this language signals to your doctor that you are not looking for reassurance. You are looking for precision. You are, in effect, functioning as the CEO of your own longevity. And a good CEO doesn't simply accept a quarterly report that says everything is fine. A good CEO asks the right questions, looks at the right data, and makes decisions accordingly. Your arteries deserve that level of attention. Your brain deserves it. And so do you. I want to leave you with something that I think about often, something that has shaped the way I approach medicine and the way I hope you approach your own health. Aging is not a single event. It is a long sequence of small, quiet decisions made by your body's chemistry, yes, but increasingly influenced by the information you carry and the questions you choose to ask. The B12 ghost protocol is not a rare or exotic phenomenon. It is happening right now in a significant number of people who are taking medications they genuinely need, eating reasonably well, and receiving clean bills of health at their annual checkups. Not because their doctors are failing them, but because the standard tools were never designed to catch this particular pattern. What changes everything is awareness. The knowledge that normal on a standard panel does not always mean optimal at the cellular level. The understanding that absorption matters as much as intake. The recognition that how a supplement is delivered is as important as what that supplement contains. These are not small details. They are the difference between managing your health and truly understanding it. And here is what I most want you to carry with you. The body, given the right conditions, has a profound and beautiful capacity to repair itself. The endothelium can heal. Homocysteine levels can fall. Cellular function can be restored. The timeline that built the problem can be gently, consistently reversed. You are not at the mercy of a silent process. You are now someone who can see it. That is not a small thing. That is everything. If this conversation opened a door for you, I'd encourage you to walk through it and share it with someone who might need it too.